All right, let's get an expert view on the timing of this announcement doing away with vaccine mandates. Dr. Isaac Bogoch is an infectious disease expert at the University Health Network in Toronto. He joins me now. Dr. Bogoch, good to connect again. Thanks for your time today. I do appreciate it. As you know, this issue has been highly politicized, but what does the science tell us on whether the timing is right now to drop these federal mandates?
Right. Yeah. So I completely agree. We've definitely heard various opinions on this, but when we just look at the data, it's clear that the policy, 2 doses of a vaccine, while certainly providing protection against severe illness, hospitalization, and death, it doesn't really do much during the Omicron era for providing protection against getting the infection or onward transmission of this infection. Now, I remind people that earlier on in the pandemic, with the original virus, with the Alpha variant, to some extent with the Delta variant, 2 doses of the vaccine provided pretty reasonable protection against infection and onward transmission. It's just a lot of that has been lost with the Omicron variant. 2 doses still provides protection against severe infection, and 3 doses, of course, is better than 2, especially for the older populations from that regard.
Right. Could this have been done much earlier? What makes it the right time?
Well, I think there's a lot that goes into it, and obviously there's more than science, public health, and medicine, and I'm sure there's other components and political aspects to this as well. But we started seeing the Omicron variant take off in Canada in around December of 2021, and certainly we've had 2 waves, a BA1 wave and then a BA2 wave. And, it was known around the earlier time of Omicron that these vaccines were, again, helpful against severe infection. 3 doses would provide better protection than 2 doses with this one because it does evade the immune system. But it was pretty clear that 2 doses of a vaccine wasn't really doing much in terms of protecting people from getting the infection or transmitting the infection to others, but still providing good protection against severe illness.
Right. So, a lot of these mandates today are, yes, they're lifting mandates for federal workers and workers in federally regulated industries. But a lot of them deal with travel and moving around. I guess it sounds like what you're saying. In other words, is the whole real life experience we've been through challenging now the validity of vaccines for things like travel?
Yeah, it is. I just think the policies have to explicitly state the goal, right? What is the goal of the policy? If the goal of the policy is to encourage people to get vaccinated, probably did, but I think we've squeezed enough juice out of that, and I think people who have chosen to get vaccinated have been vaccinated, and those who have chosen to remain unvaccinated are probably firm in their choice at this point in time. If the goal was, hey, let's create a safer indoor space, let's prevent transmission in an indoor environment, I think it was very effective. It helped. It wasn't perfect, but it certainly helped create a safer indoor space for earlier variants, but with the Omicron, it just doesn't do the same. I think we should still keep an open mind, right? They're working on updated vaccines, especially geared toward the Omicron variant. Hopefully those are successful, and hopefully we're able to regain some of that protection against infection and onward transmission that we saw with the current vaccine that we have earlier on in the pandemic.
Some have suggested the other way to go here could have been, instead of dropping mandates, would be to harden the mandates. I'm not sure how much of an appetite there is for that, but to double down and change the definition of fully vaccinated, perhaps to include at least 1 booster dose. And we know that less than 50% of Canadians have been boosted. So how effective would, I guess, hardening the approach be?
Yeah, that would be very challenging to do for 2 reasons. One is that, we got to timestamp these conversations, but if you look at the data that we have today, 2 doses of a vaccine plus an infection is roughly equivalent to 3 doses of a vaccine. So there's a lot of people with 2 doses plus infection, but they weren't able to document the infection because community level screening and testing has scaled back dramatically. So that's one issue. The second issue is that the National Advisory Committee on immunization has suggested that if people have been infected, and we know a ton of Canadians have been infected over the last 6 months, if people have been infected, you have to wait 3 months before you get your booster vaccine. So, if you mandated a 3rd dose of a vaccine, you would, what are we in, June, July, August, September, it would prohibit people from traveling for 3 months until they could get that booster vaccine. So I think there's some science plus policy barriers that would get in the way of mandating a 3rd dose.
The government says it will reinstate the mandates if there's a new variant. So 2 things, I guess. how likely are we to see a new variant that will require a reinstatement of the mandates? And two, how easily can you go back to mandates after dropping them?
Oh, I think it's hard to put the genie back in the bottle, but again, I'll leave that to the politicians to navigate. I think that'll be very tricky. I mean, related to the other point, there are going to be new variants. Of course there are. This is a virus that mutates pretty quickly. We've seen variants emerge overseas and quickly come to Canada. I think the goal obviously is with the current vaccine program, with perhaps updated vaccines, with current antivirals and access and lower barriers to antivirals and therapeutics, we can just continue to lessen the impact that this virus has on Canadian society and, of course, on the whole world. And hopefully this, it's not going to disappear, but hopefully the impact that it has continues to peter out.
It makes me want to finish on this. It's sort of a broader question, and you've sort of alluded to it. Where are we, do you think, on the management of COVID-19 in general? We were all taken by surprise when the pandemic hit. A lot of disorder in the world. Do you think, and I guess can't speak for the entire world, but for Canada at least, have we hit our stride in knowing how to manage this and possible new variants and more outbreaks?
Yeah, I mean, we're certainly a lot further ahead now than we were 1 year ago and 2 years ago. And, obviously we're still learning, and there's still some pretty incredible developments on the vaccine front and the therapeutic front. But from a clinical standpoint, when we're dealing with an individual patient, we have a lot of options that can really help people, both in an outpatient setting and those who are sick enough to be in hospital. Fewer and fewer people are dying from COVID-19, not just here in Canada, but also globally. From a public health standpoint, I think it's a bit of a different story, because obviously you need so much public trust and public buy-in for any interventions. You want to reinstate masking, it's going to be tough. You want to reinstate vaccine passports and mandates, it's going to be tough. And that requires a lot of rebuilding of public trust, which I think is an uphill battle at this point in time.
All right, Dr. Isaac Bogoch, always good to get your perspective. Thanks again for that tonight, and take care.
My pleasure. Have a great day.